Hello, Kevin. Welcome back.
How you doing today?
I'm doing great. How are you?
Good to be back.
Well, I'm so happy because we're getting really close to the enrollment time. And so you're here today to talk about what specifically?
Yeah, today I want to talk about the basic parts of Medicare. So when we talk later on about the enrollment periods, people have a basic understanding of how Medicare works first, and that'll maybe make more sense about how the enrollment periods work. That's
Okay.
okay.
And we're going to do these little short Medicare minutes for people so that
Okay.
they can watch something real quick and be informed in a short period of time because you are concise and you are good at explaining those things very quickly. So,
Yeah, I
yep,
agree. I want to get people's attention just on one piece at a time because it is a
it
long
is a lot.
and it's a lot.
Yes.
Yeah, so I did an event today at the summit, and again, it did like 30-minute PowerPoint, and you could tell you were starting to lose people towards the end. So yeah, we'll make these
Well,
just a few minutes.
there's so many things you could talk about with Medicare. So
Yes,
we don't want people to be overwhelmed. We want them to be
correct.
educated. So tell us all about all these wonderful parts.
Yeah, so we'll just talk about the Medicare basics: A, B, and D. So A, in a perfect world, everybody goes on Medicare when they turn 65 years old. Everybody's collecting Social Security 65 years old, and what that means is when they get ready to go on Medicare, the first day of the month they were born, and they're collecting Social Security, Part A and B would kick in. Now, what does that mean? A is inpatient benefits. Inpatient benefits like hospital stay, hospice, maybe skilled nursing care. We pay our whole lives into Medicare through our FICA tax. And when we get ready to go on Medicare, A is it doesn't there's not a fee to it, but we've technically paid for it. So when we turn 65, Part A would start and there's no fee. So the second part to Medicare is Part B. Part B is medical or outpatient. That means like doctors, specialists, things like that. So Part A and B is what they refer to when you hear people refer to as original Medicare.
Gotcha.
So if you are turning 65 and you are collecting Social Security, you don't even have to sign up for it. You'll automatically get the card through the mail. It's a red, white, and blue card. It'll have your Medicare number on it. It's a combination of numbers and letters, and then it'll have A and B effective date. It'll tell what they are: A, hospital; B, medical. So that's how that works. But there are out of pocket costs for A and B. Now, the third part of it is Part D, which is prescription medication plan. And the same thing, once you turn 65, you have to have a Part D. So, a couple mistakes people make, if they don't have someone explain it properly, is when you go on Part A and B, Part B does have a monthly fee. It's $185 this year, and in 2026, it's going up to $206.50. That automatically comes out of your Social Security check. If you're not collecting Social Security and you still want to get it, you can go ahead and they'll bill you quarterly. Part B is kind of optional. If you're still working for an employer or you have other credible coverage, you don't have to start Part B until you're ready, because if you have credible coverage, that makes up for it. Now, once you start Part B, you start what they call the initial enrollment period, which is very important, one time where you can get whatever you want guaranteed issue. So that's why it's important you have someone explain it to you properly so you know the timing. I'm working with several people now that have employer benefits, uh, and we always weigh out what's going to cost more. So is it better to stay with that until you're ready for Part B, or is it better to go on Part B now and go on Medicare?
Mm-hmm.
Part D, also same thing. If you don't have credible coverage, you have to get a Part D, whether or not you're taking medications. I've had several clients over the years that haven't gotten it when they were 65, and then they don't have credible coverage. Now, Part B, if you don't get Part B when you're eligible, and you don't have credible coverage, there's a 10% penalty for every year you don't have it. And Part D, if you don't get it when you're eligible and you don't have credible coverage, there's a 1% penalty every month you don't have it, and they're permanent penalties. So
Wow.
that's why this time of year, when we talk about enrollments here on the next segment, it's so important to review all that. Everybody's situation is different, and if you're still working and I'm not, I should go on probably right away, and you might be able to work and so on. So, or work and keep your benefits. So that's why it's so important people understand the three basic parts of Medicare: A and B, A is inpatient, B is outpatient. That's original Medicare. Part D is prescription, A, B, and D.
Gotcha. And where's C? Are we going to talk about that?
Yeah, I was going to throw C, and they added that in several years back. Part C is a combination. You can take your A, your B, and your D, wrap them into one plan. It's what they call Medicare Advantage. That's very, very popular now. Probably 8 out of 10 of my clients are on some type of Medicare Advantage, whether it's an HMO, whether it's a PPO. So when you get a Medicare Advantage, instead of having to have A and B as your original, a Medigap and a Part D, 3 separate parts, you would have everything in one plan through, I don't know, whether it's Humana, Aetna, United, whoever. So it's a private insurance company that offers those. Once you get a plan with that company, that carrier, that's who manages your health care. You can go with an HMO. It's what they call a health maintenance organization. It's a network of hospitals, doctors, and clinics. Or you can get a PPO, a physician's preferred physician organization, where you can go in and out of network. But all of those plans combine A, B, and D together. It's called Part C, Medicare Advantage. Sometimes they have a monthly premium, sometimes they don't. And then also, in addition to covering most of the things that A and B does not cover, you'll have co-pays. It's like pay as you go. You might have, I don't know, $20 for a specialist, $250 for the first 5 days in the hospital. MRI might be $175. It includes ambulance in and out, or excuse me, a ground and air ambulance. And then the attractive part for a lot of people, especially if it's a budget situation, is those plans also add extra stuff. They could include dental, vision, hearing, over-the-counter credit, which is free money to buy things. Some of them include meals after you get home from the hospitals and inpatient stays. Some of them include transportation. If you're chronic, you have a chronic condition like a heart or diabetes or something like that, you can get a different plan that helps offset your costs even more and adds more benefits. And if you're dual eligible, which means Medicaid, depending on the level, and also Medicare, you can get a plan most of the time at no cost. Most of the time, you don't have to pay Part B. And then also it gives you all kinds of different things, more over the counter, more dental, vision, hearing, all that type of thing. So there's a lot.
It is a lot. When are you doing your next seminar?
Actually, tomorrow.
Oh, wonderful.
Yeah, tomorrow at 3:00 at the Grand Prairie Chamber of Commerce. I'm doing a Medicare event there.
And today is what, 3rd? October the 3rd. So
yes,
tomorrow will be the 4th.
Correct.
Okay.
The 4th at 3:00. And then
so we'll put this out today.
Yeah. So and then I have another one at the summit. Matter of fact, next on the 10th, next Friday, I'll be sponsoring the summit. They're having a line dance. They already have over 100.
Wonderful.
Yeah, 100 seniors lined up. So that should be fun. So yeah, we got a lot of stuff going on. And then of course, as we do the next episode or two, we'll have my information, my contact information. People can call me because now's the time of year to start making appointments. Because my appointment schedule is starting to fill up pretty good. And listening to these little sections we're doing now instead of 20, 25 minutes at a time, people can digest it a little bit quicker before we move on to the next one.
I agree. Well, good. We'll have all that in the post. And thank you so much for coming on today.